Let's bring in Angelique Coetzee from Pretoria. She is the head of the South African Medical Association, and she helped identify the Omicron variant. We are so grateful for your time, Angelique. Thank you for joining us here on the News Hour. Can I start by asking you, do you agree with the South African government's assertion that the peak is over and that numbers are going to continue to decline?
Good morning from South Africa. I think it's a bit early to say the numbers are going to decline. We still have an average of a positivity rate of around about 28%. And again, you know, the next 2 weeks will be crucial to see whether we will get a slight increase again. I'm not so comfortable by saying that we are really out of the peak of the fourth wave. There was pressure put onto the government to lift some of these curfews. I think it's a mistake. We keep on saying that we need to stay away from big gatherings. We keep on saying you have to wear your mask. Nothing of that's changed, you know. These numbers is not, you know, we're still above 12 or 10,000 cases per day. If it was 5,000 and less, yes, maybe then we should look at it. But I think they're making a mistake here. But there's pressure, I know.
These numbers, though, in South Africa are nothing compared to what we're seeing come out of Europe, where the numbers aren't going down. They're hitting new records every day now. So what's the difference? How is South Africa managing to see less infections while we've got countries like France, the United Kingdom, Italy hitting new records?
So I think what is important is you need to understand we are now in our 8th week of Omicron. So we also started late with vaccinations. We started in end of May this year with for the vaccinations with our population. That's one of the things that some of these vaccines are still a bit of protective against the patients. And then a lot of people had Delta virus infections. We had quite a huge number of Delta cases. So there's a lot of factors, I think, that might play a role here. The other one that is extremely important is that we have never totally discarded the wearing of masks. And masks are extremely important. You know, whether you want to prevent the disease, whether you want to bring down infection rate, masks and social distancing and air or circulation, very important. And I don't think people always understand this. And the vaccines are also important, but vaccines alone is not going to save us. You cannot vaccinate yourself out of a pandemic. You have to have a lot of other measurements in place as well.
That's interesting because the world really had been holding on to this hope of the vaccine. Once you've got your vaccine, then you'll be protected. Get your booster, then you'll be protected. But you're saying it's much simpler everyday steps that people can do that perhaps they're getting a bit reluctant with.
Yes, definitely. So what people doesn't understand about the vaccines is vaccines are going to protect you, especially against severe disease and hospitalization. I have seen 3 of my patients that were admitted with pneumonia. All 3 of them had been vaccinated, and none of them there was any need for them to intubate them. They've all already been really discharged from hospital. And if it wasn't for the vaccines, I think they would have been severely, really ill. So the vaccines will protect you against severe disease as well as hospitalization. And if you are hospitalized, you should be able to recover quite easily in comparison with people that's not vaccinated. And if we look at what happened during the Delta patients that was admitted to hospital, they were seriously ill. So vaccines, however, we have seen that they are waning. We have seen that you can get mild disease. And here lies the problem, because the more we say that the majority of people will get mild disease, even if you have been vaccinated, is that people then think, it's okay, it's not so serious, I don't have to go to the doctor. And incidentally, these 3 patients, that was their mistake. When they were diagnosed, they didn't come to me, and I was not aware of their diagnosis. And all 3 of them, diabetes, severely overweight.
Can I also ask you, looking forward, if you could look into that very skilled crystal ball of yours, what's the next mutation we need to be looking out for? We have heard that Omicron gives us a bit more of an antibody protection against Delta. Does that mean that people could be more protected against future variations?
Yeah, you can. But again, it depends on where the mutations will lie. So, never forget that this virus, someone said to me, but the virus doesn't have a brain. Yes, I know it doesn't have a brain, but don't underestimate this virus. This virus wants to survive just as much as me and you want to. And they would mutate in such a way that the vaccines would have less of a protective effect so that they can still survive. It's not to say that the vaccines won't have any effect. It will just be less. And then it would depend on how good your antibody response is. And that would also depend on your weight, on your chronic disease profile, how good your lifestyle is. And if you wear your masks, if you wear a clean mask every day, do you wash your hands? Are there enough sanitation? Are there water where you stay? How good are the government in providing ventilation in public sector buildings? All of that will play a role, and that would determine how the viral mutation would go forward. Hopefully, we would see the same, more or less the same picture. And again, most people, should be vaccinated or have natural infections. There was a nice study, it still needs to be peer-reviewed, which Prof. Glenna Gray and her team did. And I saw it yesterday, so it's very, very new, where it actually said that, your T-cell response, and this now was done with Johnson & Johnson, after your after your boost, 6 months later, your T-cell response and antibody response is nearly 12-fold increased. So, you want your body to remember. It is extremely important that your immune system remembers the virus, so it won't be there. Your antibodies is not going to stay with you the whole time. It's going to wane down. But it's how good your memory are, your T and beta cells. Very important, and that will most probably save us going forward.
We will definitely be keeping an eye on it, and we appreciate your expertise. Thank you so much for joining us live from Pretoria.
Thank you so much, and please have a wonderful 2022, and please just do the simple things. That's going to be the answer. That's going to save you.
Thanks for your advice.